This is my presentation in the Cheran College of Physiotherapy, third time. Thank you for everyone supporting to me, and then I want to encourage our student to come up advanced techniques, advanced treatment for physical therapy. They must to know the faculties and student. Okay, that has to be something different topic. Okay, extracorporeal shockwave therapy. This is, we are a long time using traditional therapy, ultrasound, ponoporosis. This is the next level of treatment for the sharp tissue injuries. The people facing any tendinitis, okay, inflammation cases, okay, this is one of the advanced treatment. Mostly they are using for Europe side, okay, and Asian side like India, Pakistan, Sri Lanka, this side, some of the any facilities, hospitals, they are using this treatment. But still, this is a little bit costly equipment. This is around 5,000 USD dollar. They want to purchase, but there is a portable extracorporeal shockwave therapy machines also available. Okay, they can carry, they can go to any home visits, they can carry easily. But the equipment wise, it will be a little bit costly. Okay, anyway, so we will discuss some of the interesting topic: extracorporeal shockwave therapy in physical therapy. Okay, we can say e-shockwave therapy. How we can say e-stimulation like this. It is the e-shockwave therapy in physical therapy. Okay, today we will discuss the uh, objectives. We will discuss the following items. In end of the presentation, you will be describe the mechanical characters of extra shockwave therapy, identify the musculoskeletal pathology that may benefit from extracorporeal shockwave therapy, and what's the physiological effect and mechanical effect of this extracorporeal shockwave therapy in sharp tissues and bones. Okay, so what are the outlines today I'm going to discuss? Okay, first, how it's developed, this extracorporeal shockwave therapy, the history, okay, and principles of protection, okay, and third point, characteristics of extra shockwave therapy and energy production, and fourth point, physiological effect and mechanism of the action, how we can apply as an clinical application, what are the adverse effect, what's the evidence-based practice, what's the evidence-based practice saying about extracorporeal shockwave therapy. Okay, so let's first discuss the, as I mentioned in the outline, extracorporeal shockwave therapy, essential and history. Okay, extracorporeal shockwave therapies, they introduced in 30 years ago, around 1970s. They introduced for the people having renal calculus. Okay, the urologist, they used this technique. Okay, shockwave therapy. They remove the calculus from the urinary ureter and urinary bladder. Okay, so this technique used and in the medicine field in the beginning. Okay, later on, okay, in the 90s 80s, okay, they introduced for the musculoskeletal therapy in US. Okay, in US, then expanded to the UK and many other Europe countries. Okay, so slowly it's developed this extracorporeal shockwave therapy equipment. So in the 1990s, the reports to start appear in the journals. Okay, the many of the practitioners, physical therapy practitioners, they are published how effective for the extracorporeal shockwave therapy. So lots of experts in physical therapist, okay, they are published. Okay, uh, like systematic reviews and case control studies. They are published a lot of articles about the extracorporeal shockwave therapy. Although this becoming a much popular in Europe side. Already I mentioned. Okay, especially in UK, they are using this technique and wide and very advanced technology in, especially in the musculoskeletal physical therapy. Okay, so this is very trending. There is a lot of techniques nowadays trending, especially in the musculoskeletal therapy, sharp tissue problems. Matrix rhythm therapy, one of the very popular. Okay, in everywhere, Europe side, our Asian side, it's very much popular, this matrix rhythm therapy. Same like this shockwave therapy also, one of the popular. And then third one, magnetotherapy. So these are the advanced technique nowadays in this field of physical therapy. Okay. So today my topic very consists to the only related to the extracorporeal
Sir,
shockwave therapy.
வணக்கம்.
So first we
மெயில்
must
பண்ணிட்டேன்
to
சார்.
know the
அது
what are
தகவல்
the
கொடுத்தாங்க.
definition of the
அப்படின்னு நவீன்
extracorporeal
பேசுறேன்.
shock therapy.
அவர் வந்து
Okay,
மண்டே தான்
so this
வந்து
is is
சண்டே தான் வருவேன்.
acoustic
ஃப்ரைடே
large amplitude
நீங்க
compression
சண்டே வர பிளான்
wave. It's
ஓகேவா
a
சார்?
high pressure peak adjustable to
நான் இன்ஜினியருக்கு
limited
சொல்லி
frequency
வச்சிருக்கேன்.
range
நீங்க சைட்டை
within
பார்த்தா
one the
நான்
wave
டிராயிங்
side. The
பண்ணி கொடுத்தேன்.
positive
ஹார்ட்
pressure
காப்பி ஒன்று
increase
ரெடி
in short
பண்ணிருக்கேன்.
time
ஸோ
follows a
இப்போ
negative
டீம்ஸ்
pressure. Okay,
சார்
you can
மண்டே
see the
பேசலாம்.
small picture over the above. This is the way how the
டீம்ஸ்
guns.
பெட்டரா
This is the gun. Okay, this name
டைமிங்
is
போட்டு ஷெட்யூல் பண்ணிட்டு
called
உங்களுக்கு
in the
இன்ஃபார்ம்
shockwave therapy gun. Okay, this gun directly delivered to the
சரி ஓகே
tissues,
ஓகே
muscle, skin area.
சரி
Okay,
நானும் சார்ட்ட
so
அதான்
this is the
சொன்னேன் சார்
how
உங்க
the
ஹாஸ்பிட்டல்
machine
செக் பண்ணிட்டு
delivering
உங்கள்கிட்ட
directly to
பேசும்போது
the
கிளியரா
patient's
பேசணும்னு
skin.
சொல்லி விரும்பினாங்க
Okay,
அந்த மாதிரி
so
சொன்னேன்
this will
சரி
be
ஓகே
delivering
அப்படின்னாரு சரி
large
இனிமேல் நான் உங்களுக்கு அனுப்பிச்சிருக்கேன்
amplitude
சார் நீங்க
wave.
பாருங்க
Okay, it's a high pressure positive pressure.
ஆமா
Okay,
நீங்க
already in
அதாவது
tissue
பிளாக்
there's a
வைஸா
negative
இருக்கும்
pressure
சார்
is there, so
நீங்க
this will
பார்த்துட்டு
be a
ஏதாச்சும் டவுட்னா
delivering as
கூப்பிடுங்க
a positive pressure. Okay,
சரிங்க சார்
so let us to be a discuss
ஓ
the
ஓகே
all your third year when you are studying
நோ
third year
ப்ராப்ளம்
student.
நான்
Okay,
உங்களுக்கு
you will be
நான்
study electrotherapy, one of the important in our field. Okay, so first you have to be know the physics, then only you have to be understand the how the this machine will be delivering to the patient. So let us to be discuss the physics first. This characteristics of shock wave. It's a high peak pressure, positive pressure. Okay, 50 to 80 megapascal. Okay, this is the maximum delivering to the patient. Okay, the pressure, and then positive pressure always to be any duration less than 10 nanoseconds. So it will be directly reaching to the patient skin 10 nanoseconds. That means too much high speed delivery of this equipment. And short life duration less than 10 seconds. Narrow effective beam, the beam the shape 2 to 8 millimeter nanometer. Frequency it will be a 16 to 20 megahertz. Okay, so it will be a pass of the negative pressure. It will be you can see the graph. Okay, so you can see the 50 to 10 nanoseconds, the duration is maximum will be a 10 megapascal. So this is the physics, completely physics, how it will be this machine will be delivering to the patient. Okay, next the principles, how this will be working to the machine to the patient. There is a 4 principles. First one is the, you can see in the picture. Okay, let's show. Okay, there is a shockwave therapy. There's a 2 types. Okay, first you have to be understand the focused one. The another one is the radical. Okay, the focused one, it says to be 3 principles. Okay, spark, discharge, piezoelectric effect. Piezoelectric effect, it's just typically an ultrasound. Ultrasound, it will be delivering to the any electrical charge converting into the mechanical effect. This is the piezoelectric effect. This is the principles of ultrasound. Okay, and then electromagnetic. Electromagnetic, it's a magnetotherapy. There is one of the treatment in electrotherapy, magnetotherapy. So electrical activity converts into the magnetic. Okay, so these 3 principles. Okay, spark, discharge, piezoelectric effect, and electromagnetic effect. So these 3 as a focused hard shockwave therapy. This is the one type. Another one, pneumatic therapy. This is the radial shockwave therapy. Okay, so which one we can use for the focused shockwave therapy? Another one, radial shockwave therapy. Let us to be discuss in the next slide. See, you can see very clear picture this one. Okay, so the first one is the focused, second one is the radical. You can see skin, muscle, bone. This is the focused. The second one, skin and muscle only, radiating to the only skin and muscle. So which condition we can use for the focused, which condition we can use for the yani radical type? Okay, first one, okay, if the patient having non-union the bone, okay, or malunion, okay, this kind of yani, sharp tissue problems, if the people having non-union and malunion, they will also get the yani, sharp tissue problems. The secondary complications, they will affect in the sharp tissues. Okay, so these conditions we can use for the focused. The people are having very typical problem, tennis elbow, okay, tennis elbow, shoulder impingement syndrome, okay, and golfer's elbow, Achilles tendinitis, okay, and plantar fasciitis. This kind of cases we can use directly to the radical shockwave therapy. So it's very clearly mentioned this only effect in the skin and muscle. So this will be a penetration less than 3 centimeter, but the focused you can see 12 centimeter penetration to the until the bone. So this is the difference between, okay, and focused and radical shockwave therapy. Okay, so this is if you choose in the machine, on the machines itself, okay, once you on the machine, okay, it will be a directly guiding. Okay, this you want to focused shockwave therapy or radical, you can choose it option. Okay, if you want to treat the sharp tissue problems, you can choose directly to the radial shockwave therapy. If you want to bone related, okay, problems, okay, and secondary impact to the sharp tissues, you can choose as any focused shockwave therapy. Okay, so this is the based we are want to choose the therapy. Okay, let us to be the focused and radical, the differences and frequencies, intensities, everything we will discuss. So the focused shockwave therapy, it's a electromagnetic, already we discussed, electrohydraulic, and then radical, it's a pneumatic therapy. So this will be an 100 to 1000 bar pressure. The pressure will be any more pressure in the focused, and pulse duration 0.2 microseconds, and energy flux will be a 0.01 millijoules per millimeter square. And then radical, the 0.01, both are similar. Okay, and focus, okay, this is the focus, mainly it's focusing into the bones. Okay, and this one, it's the radical will be focusing into the mainly sharp tissues. The penetration, already I mentioned, it's a penetration, it's a 12 centimeter into the deep to the tissues, but this radical will be less than 3 centimeter, okay, effect. That means this is the superficial effect. Okay, this will be a very deep effect. This is the difference between two types of the shockwave therapy. Okay, so which part will be a more effect? The radical will be a more effective in the sharp tissues, muscles, okay, muscle, skin, superficial, okay, area. And then this one focused will be a more effective in the cellular and bone. Okay, so the treatment duration, okay, the focused will be a 1 to 3 minutes, okay, and radical 3 to 5 minutes. Okay, so this is the basic principles of the shockwave therapy. Let us to be discuss the next slide. There is a three different types of energy influx: low, medium, high. Okay, low, less than 0.08 millijoules per millimeter square, this is the low level. High level 0.28 to 0.6 millijoules per millimeter square. Okay, so this is the basic energy influx to the tissues, okay, transmitted to the tissues, directly to the transmitting to the joules, directly transmitting to the tissues. So you can see this slide, it's very clearly mentioned. Okay, if you are using low level, okay, it will be effect in the cell repair and regeneration. If you are using the middle level, it will be mostly relieving the pain. Okay, so if you are using high level of the energy, okay, it will be people having non-union, bone, the people are after the fracture, okay, some of the fracture complication is one of the complication in, the non-union malunion, right? So the non-union cases you can use high pressure, okay. The people, okay, the lithotropsy means people having renal calculus, okay. The renal calculus people, they will use more joules. You can see 4 millijoules. It's very high frequency, okay, because it will be penetrating very deep, okay. So this kind of cases they are using, okay, lithotropsy, okay, the renal calculus patient, okay. So this is the energy flux density in the patient. The same slide explained to be here also. This is the one of the articles published in 1998. It's a too long ago. It's effect of the tissues, okay, how the shockwave therapy affect, we are using physical therapy field and medical field in one of the department urology. They are also using shockwave therapy. So for our field, okay, physical therapy, we are using for mainly tissue cell repair and muscular repair and reducing the pain, okay. This is our main goal to the patient soft tissue problems, okay. So what's the mechanism of the extra shockwave therapy? So mechanism, there is 3 important mechanisms, okay. So direct effect, directly to the physiological effect, and the mechanical effect. Indirect effect, biological effect, okay. Physical effect means directly to the physical and mechanical, directly to the tissues. Biological effect mean indirectly, how the the blood vessels, okay, and the other soft tissues, how it will be getting benefit, okay. So first we will discuss the physiological effect, okay. That's the physiological and mechanical effect in the shockwave therapy. You can see the physiological effect, okay. Very clearly it's mentioned, okay. Changing membrane permeability, the ionic blood flow, okay. That means increasing the cell membrane blood flow, okay. Inside the any negative pressure will be is there, okay. This extracorporeal shockwave therapy will deliver the positive pressure to the tissues to making ion transport, positive and negative transport, that means neutralized, okay. The gas bubbles already is there, okay. So it will be a releasing this gas bubbles, you know one of the therapy, chiropractic, okay. The people are taking any tractions, okay, taking nodding into the spinal, okay. There's inside the tissues will be a gases, okay. This gases will be sometimes producing to the patient. So this same effect, okay, extracorporeal shockwave therapy also will produce same effect. If any gases inside the tissues, it will be a release, okay. So this is the very effective to the tissues, especially in the membrane permeability, to increase blood flow also, increase, okay. Ion transport also will be a balance, okay. Inside and negative, positive pressure and negative process always will be ions transport between the cell membrane. In the neurology you studied, on physiology also you studied the student, okay. The membrane permeability will be a increase, okay. Next, so what are the biological effect? The biological effect is the indirect effect to the tissues. Indirect effect means increasing the, most of the students you studied in the growth factors. There is a lot of growth factor in our body, okay. First one is the, you can see in the BMP, okay. BMP is a bone morphological protein, one of the growth factor. And then next one is the nitric oxide, okay, growth factor. And then venous electro growth factor, okay. There's a lot of growth factor in our body, okay. So this growth factor will be improve the blood supply, the vascular blood sub new vessels will be developed inside the tissue, okay. And then people having the tendon, we have a lot of tendinitis problem in our body, supraspinatus tendinitis, many tendons, biceps tendinitis, lateral epicondylitis. These are all are tendon problem. So the tendon problem also, it will be getting regrowth and bone growth. Okay, so the tissue will get regeneration. Okay, the degeneration and the regeneration. Okay, how it will be this is a very important point. Okay, how the tissue will be getting regeneration. Okay, as a physical therapist, okay, we are giving, we are making tissue injury. This tissue injury, after the tissue injury, the tissues will get regeneration. We are making per we are making tissue injury. How we are making? Through the gun. Okay, so all the tissues we are activating. Now the right word we can say as activating the cells, around the dead cells. Okay, we are activating. So once activated these cells, okay, inflamed area, okay, the cells are automatically will be getting regeneration. That's a simple understanding. Okay, regeneration means we are through machines, okay, through the ultrasound, through shockwave therapy, iontoporosis, ponoporosis, TENS, all the principles. What's the saying? It will be we are making, okay, activating inside the dead cells or new cells, both dead cells also we are activating and new cells also we are activating. So through this new cells will releasing the pain. Okay, the function also, the patient function also will be improved. Final, if you take it any orthopedic cases, our two main goals, okay, we want to reduce the pain, and second thing, we want to improve the patient function. Okay, so this machine, okay, extracorporeal shockwave therapy, first function it will be reduce the pain, second improve the patient function. Not only this machine, okay, all most of the our electrotherapy equipment, okay, first to reduce the pain, and second important thing to improve the patient function. Okay, to how improve the function? Through exercise. Okay, we are treating two ways. First we are treating as a modalities, multiple modalities, all the modalities. Okay, and other part we are treating as a exercise. So this two as finally this okay, so finally we are achieving the patient improvement. Okay, this is a simple understanding for the student. So next, the physiological effect. Already I mentioned very clearly, it's a physiological effect and mechanical effect, and improving the all the modalities. Main goal to improve the blood circulation and neovascularization. Neovascularization means new blood vessels getting growth. After giving the shockwave therapy, the new blood vessels getting growth. That means how it will be getting growth? Through the new growth factors. Okay, this new growth factors will be inducing to the inside the sharp tissues. Okay, people are getting the patients are getting growth, okay, inside the blood vessels. And then third point, increase the cellular activities. Already I mentioned, okay, all the growth factors names. Okay, nitric oxide, okay, bone morphological proteins, okay, growth factors, all this will be getting increase. Okay, and then fourth point, reducing the substance p. Okay, substance p, it's the one of the mainly pain aggravating factor. Okay, so this extracorporeal shockwave therapy to directly affect on the substance p. Okay, to reduce the patient pain and edema. Okay, so this is the another effect. And then fifth effect, it will be an analgesic effect to the afferent fibers. The pain gate theory, the I don't this is a very big area. Okay, Melzak and Watts, okay, they are described the pain gate theory. So this will be very effect in the analgesic effect in the pain gate theories, and break down the calcification in the additional calcification in the tissues. Okay, and then final very important effect, it's increase the collagen synthesis. Collagen, the lot of collagens inside the sharp tissues, so it will be a production in the more production in the tissues. So next, what are the conditions we can use for the extracorporeal shockwave therapy? Okay, so let us to be a first upper limb. Upper limb, you can see the tennis elbow, golfer's elbow, okay, supraspinatus tendinitis, okay. This kind of cases we can use in the upper limb, okay, especially in the sharp tissues problems, okay, bicipital tendinitis, okay. Here it's mentioned less number of tendinitis case, but all the tendinitis case you can use this extracorporeal shockwave therapy. And then lower limb, you can see the great retrocontract pain, people bursitis, okay, and patellar pain syndrome, okay, patellar tendinitis, okay. We can use this treatment. And medial tibial stress syndrome, okay, we can use, okay. And then Achilles tendinitis, and then plantar fasciitis. Let's give my experience in this extracorporeal shockwave therapy. I used around using this machine around maybe 7 to 8 years effect of this machine, okay. My experience, this equipment very effective in the Achilles tendinitis, plantar fasciitis, supraspinatus tendinitis, tennis elbow. These 4 cases I feel patient feedback, okay, they are experienced as a good, very good pain relieving modalities, okay. But other conditions still I cannot give the exact answer, but especially plantar fasciitis, the patient are they are feel good, effective pain relief this modality, okay. So you can see the other indications, lateral epicondylitis, okay. The where it will be inflamed, common extensor origin. This is any basic anatomy. People with the supraspinatus tendinitis, okay, and patellar tendinitis, okay, Achilles tendinitis, plantar fasciitis. This is the commonly we are using for this extracorporeal shockwave therapy. And then next slide we will discuss about the how we can use this clinical application, how much energy joules we can use for the patients, okay. In this machine, okay, if on which condition you want to apply it, automatically in the machine, okay, in the screen will be how much joules, okay, acute, subacute or chronic. It will be asking the screen question, okay. You can choose, okay, acute case or subacute case or chronic case. You can choose it, okay, whatever you want you can choose it, okay. So low, medium and high, we already discussed this title. So next we are going to discuss about the how many shocks we can deliver to the patient. The effective shocks, 1000 to 2000 shocks, it's the most effective shocks. Shocks means if you apply handle, the physiotherapist will handle the gun directly applying to the patient's tissue, okay. The shocks 1, 2, 3, 4, 5 like this, okay, like this 3 to 5 minutes, okay. You can the machine will deliver 1000 to 2000 shocks to the patient, okay. If you are applying less number of shocks like 100 to 500, it will be not effective, okay. So the universal recommended shocks 1000 to 2000 shocks will be a highly recommended to this any kind of sharp tissues injuries, okay. This is any recommended suggestions, okay. So another question, how many days we can give this treatment session? This is any normal question. The patient will ask to, can I come how many sessions? Simple, okay. My suggestion, weekly 3 sessions, okay. Take it 8 to 10 sessions. That means 3 to 4 weeks recommended. So the most of the the soft tissue cases, the universal standard, the worldwide, how many sessions will be recommended? Okay, first will be recommended 8 to 10 sessions. They will observe, they will do after the 8 to 10 sessions, they will do follow up. Okay, so this 8 to 10 sessions will be patients get benefit, patient will be discharged. Okay, if the patient partially recover, you can extend another 4 to 6 sessions. It depends upon the patient improvement. As a physical therapist, you can decide it. Okay, so the sessions alternative days, don't give it to daily. Because why you don't give it to the daily? Okay, so you are giving example today the session. Okay, so you have to be give the rest. Why the rest? The tissue to take regeneration, remodeling process. Okay, that means the activating inside the growth factors, everything you need to give rest. So don't give it the session daily. Okay, daily is not recommended. Okay, so the recommended session alternative days, like Monday, Wednesday and Friday, or Saturday, Monday and Wednesday. Like this, you have to be choose the sessions. Okay, that means simply alternative days you can choose the session. So I will discuss only one case here. Okay, Achilles tendinitis. Okay, you know, where it's incisional. Okay, where we have to be apply the, which part of the area we have to be apply the shockwave therapy. So very important. Okay, you don't apply to the origin area, don't apply into the in the origin incision, in the middle part, don't apply in the middle part. You have to be a muscle, or the muscle and tendon, it's the end of the part directly inserting to the bone. Okay, you have to be apply near the incisional area, because this area only is tendon is present. Example, supraspinatus tendinitis. Okay, where is the supraspinatus tendon will be inserting? It's near to the greater tuberosity. So 2 centimeter, okay, from the incision area away you can apply. Okay, so this is the recommended, very important. Okay, so 2 centimeter to 6 centimeter near the incisional area you can apply over the your shocks. That means apply your guns to deliver the shocks. So what are the yeah, patient's subjective complaints? Okay, usually the patients having, always they have complaint as a pain and swelling, impaired performance. That means difficult to moving their limb, difficult to moving the overhead activities, difficult to make the dressing, difficult to do the shoes, the patient functional problems. Okay, so the next one, how many studies, nowadays everything is evidence based practice. The worldwide nowadays, you know all the fields. Okay, if you go to the any hospitals, okay, it's a multi-specialty hospital, super specialty hospital, any condition, okay, they want to give according to the evidence based practice treatment. This is any worldwide now trending. Okay, as any students or any faculties as therapists, okay, you have to be know the which is the best treatment, and then right time we have to be deliver. Okay, so 11 studies reviewing about the extracorporeal shockwave therapy. Okay, they produce greater short term and long term improvement, both pain and function. Okay, compared to other non-operative treatments like footwear modification, steroids, okay, non-steroidal anti-inflammatory drugs, stretching and strengthening. Compared to other treatment, non-operative, that's conservative treatment, compared to other conservative treatment, this more supporting to the extracorporeal shockwave therapy. So next, what is the parameters will be using for extracorporeal shockwave therapy? Pressure 2 to, you can see in the picture, See the position of the patient, how the therapist applying to the Achilles tendinitis treatment. You can see very clearly the position of the foot. Okay, pressure 2 to 3 bars, frequency 5 to 10 hertz, patient position very important, lying on the back supported with the knee, and frequency of the treatment 5 to 10 days or 15 days, number of the treatment, okay, 3 to 5 sessions. Okay, so this is the treatment effective in the stress shock therapy. And what is the contraindication for the extracorporeal shockwave therapy? So what are the extracorporeal shockwave therapy contraindications? Okay, you know, the people having the lung tissues problem, lung infections, okay, don't do during the infections, don't to give this therapy, okay, especially lung infections, you know, the COVID, okay, the people having the COVID infections, that kind of patients should be avoided. Okay, uh, okay, there is a very good questions. Second contraindications, okay, pediatric, pediatric less than, okay, 15 years, okay, don't apply the shock therapy, okay, especially in the bone epiphyseal plate, you know, still they are growing stage. Okay, less, you know, some of the studies saying less than 12 years, okay, still they are less than 15 years. My recommendation, less than 15 years, okay, especially don't apply the official growth plate. Example, okay, you know, the patellar tendinitis, okay, you know, the growth plate, it's very near, okay, tibia and fibula, it's very near, okay, you know, the epiphysis, right, epiphysis, metaphysis, right, you know, the bones, the parts of the bones, okay, so don't apply less than 15 years, very very important. Okay, don't apply less than 15 years the patients. Okay, patients who are hemophilic, okay, and anticoagulant therapy, you know, already hemophilic patient, already they are bleeding, the inside the and the tissues will be bleeding. Okay, the people anticoagulant, you know, the people are taking aspirin, okay, for cardiac patients. Okay, don't apply for the extracorporeal shock. If you are applying, it will be increasing more bleeding inside the tissue, so it will be contraindicated. And then you know, the malignancy, people having the cancer patient, don't apply. Okay, and then people inside the metal implant, like patient is they are already fixed with the fracture, there is some plates and screws, okay, don't apply for the extracorporeal shockwave therapy. Okay, in and then local infection, example, you are going to apply in the Achilles tendinitis, okay, the people having the around the ankle, there is some infection, skin infections, okay, some wound, okay, don't apply. Okay, simple and easy to understand. And then people did any joint replacements like THR, okay, TKR patients, don't apply to the this kind of therapy. It will be sometimes getting, you know, the patient, they will say complaint, okay, you after giving your therapy only I'm getting this problem. So don't always we want to protect, therapist always should be first safest practice, very important. Okay, about this machine, okay, you know, if you are applying in your body guns, shocks, they feel some discomfort, you know, this is people having very discomfort about the machine. Okay, so this is the one of the adverse effect. The second one is subcutaneous hematoma. That means the local tissues will get some swelling after the therapy, okay, because it's delivering high frequency, okay, shocks. Okay, so it will be a resolve. That's why I told you to that this therapy will be an alternative days. So local tissues will get the hematoma, and then local irritation. Okay, the radical shockwave therapy sometimes will be people feel local irritation, the people they feel cosmetic reason, you know, some people if they are touching to their body very discomfort way, they feel very discomfort. So this is the local irritation, the patient will feel the another thing. And then I reached end of the part. Okay, so uh, this is the, you know, according to the University of South Carolina, US, you know, the evidence based practice. Okay, This is the very important. Okay, according to the evidence-based practice guidelines. Okay, this extracorporeal shockwave therapy level 3 evidence. I'm repeating again. This is the level 3 evidence. Level 3 evidence means it's a moderate evidence. Okay, the number one evidence always will be a systematic reviews. Okay, and RCT. This always will be a level 1 evidence. So mostly, not only the extracorporeal shockwave therapy, in whole electrotherapy, the lot of journals, not I'm not saying, okay, the journals or articles, okay, electrotherapy supported as a level 3 evidence. Okay, that means it will be reducing the pain, okay, and also improving the function. Okay, but and in the journals or articles saying it's a level 3 evidence, that means this is a case control studies or cohort studies will be a fall within this category. Okay, so I will summarize simply, okay, before closing this session. Okay, let's give small summarization about the extracorporeal therapy. Some important theme of this presentation. Okay, extracorporeal shockwave therapy. Okay, there's two types. Very simple. Okay, focus. Did you heard about the summary or not? Because the summarization I added some important points. Hopefully you are listened. Okay, if you have any questions, whatever you want to ask, Tamil or English, whatever you want, you can ask, or other languages also I can answer it. I think this is very helpful for this topic for students also, and same time the practitioners. Okay, the physical therapy practitioners, our India. Okay, our people are very advanced equipment. Nowadays some of the therapists I noticed, matrix rhythm therapy, magnetotherapy. Okay, many of them they are practicing. Okay, if you want any guidelines or anything, okay, I will surely support to our professional people. Thank you very much for your Cheran institutions.